This is mine. This is one that a student did, but it's good, so I'm going to leave it up there. These are the ones that we need to know on the sheep brain for the practical. You do not need to know all of the nerves. You will be amazed at how small some of these nerves are. So we are only making you responsible for those most obvious ones that we did a picture of in lecture. Olfactory, optic, oculomotor. Trochlear is tricky. That's the only one that can be hard to find. You might need my help with that one in abducens. All the mess down here between the pons and the medulla, we let go. They're taken from slaughter, and you'll find that when we remove, as always, when we remove from slaughter, things are iffy and dicey in terms of how much we have attached. But in regard to the cranial nerves, when we take off this silvery white outer covering, that's the dura mater, oftentimes they're so delicate that they'll pull off with it. So sometimes you have to look on the dura mater that you've removed, and you'll find the nerve still attached. Okay. Inferior perspective, posterior, anterior. I forgot a probe. Can somebody grab a probe?
There's one on my desk.
Thank you. Anterior most, you tell me, what are these? Thank you. Are olfactory bulbs, and then we'll see the tracts running from the bulbs back toward the brain underneath the dura. So we have to go in there to see that first. And then right here in the middle, we're going to go for our landmark pituitary gland, which is right here. We're going to trim away any material that we have around it so that we can see it best. Trim there. And trim there. Here are the ends, right here, of our optic nerve, where they're approaching that area of crossover. Remember what we drew on the board yesterday? The pituitary gland. Bang, it's right behind that area of crossover. Flanking the pituitary gland, these two large nerves are the trigeminal. And they'll be more obvious when we take the dura mater off. Everything else we have to find we can't see right now. We have to remove all this dura mater. So to do that, we're going to turn it over this way. Here is that falx cerebri running down the longitudinal fissure and that tentorium cerebelli that we talked about in lecture yesterday. You will be surprised at how tough this dura mater is. It is, as the name implies, durable. So take a sharp pair of scissors, the ones that look almost like nail scissors, are best. Make a little incision right toward the back where the falx meets the tentorium, and then cut forward all the way towards your bulbs on both sides of it. Really tough. It's hard to get under there. We should be able to peel it back on both sides. You can feel that when you have your gloves on. It's very, very fibrous and tight. Not very stretchy at all. It's kind of resembles, I think, those Tyvek envelopes that you can send things in through the mail. Have you ever gotten one of those in the mail? Can't tear it. White. Over your pants. All right, so now here's our falx running right down the middle. I'm pulling it out. It's very, very rigid. Coming toward the back here, then we're going to nick that right where it meets the cerebellum. This is the hardest part right here. I'm going to come at it from several different places. Pull it up. You can tell from the snapping sound that I'm having to kind of apply a fair amount of pressure. Have you ever seen the movie Young Frankenstein?
The black and white one?
The Mel Brooks movie?
Mm-hmm.
The comedy?
Yeah.
Oh my gosh, you really got to see that movie. Especially since It's all about brain transplants. It's very funny. Young Frankenstein, gotta get it. Wow, I'm feeling really old. If you don't know that one. There are some famous passages about the brain in that movie that you'll find pretty funny now that you've done this. Okay. All off the top, two nice cerebral hemispheres, frontal lobe, parietal, temporal, occipital. Longitudinal fissure running right down the middle. At the back, the cerebellum. We pull, and then what we can see from this perspective of the brainstem. You pull the cerebellum down. Now, you're looking at the vermis connecting the two lobes of the cerebellum. And right here, with the cerebellum pulled down, we see the body of four, or the corpora quadrigemina. See it there? The body of four. So you have to pull the cerebellum down to see that. Then, right in here, I have to make a little hole so you can see it. Right in there, from this perspective, you could see our pineal gland, the one that secretes melatonin and is endocrine in function. Right in there. Now, they'll often show it labeled with a longitudinal view, but it's important for you to be able to see it from that view also. So corpora quadrigemina, or body of four, that's your rear perspective on the mesencephalon. Pineal gland above it, vermis, two lobes of the cerebellum. What did you put on your pop quiz for the main difference between the cerebrum and the cerebellum?
Cerebellum is for posture.
The cerebellum is for coordination.
Coordinated motor activity, especially rehearsed, learned physical motor activity, versus cerebrum. Cognition, meaning thought processes, as well as the level of intent for motor action, so it originates here, or sensory perception, visual, olfactory,
So
etc.
like visual and language. And all that.
So cognitive and perception, primarily. That's just a basic division there. Okay. And we're going to... And they're preserved, so you'll feel your eyes burning. Be sure you have your eye protection on today. Okay, then you cut right down the longitudinal fissure and you see it fall open, and we can see some other important structures now. This right here, this white body that you see, is actually the optic crossover or chiasm cut in half. Don't confuse it with the pituitary gland. Pituitary gland's behind it. Here's the infundibulum right there, more continuous on this side. Just that little stalk that holds the pituitary, or from which the pituitary gland dangles. You can look in the pituitary and you'll see areas of different texture associated with the front and back. One's more fibrous and the other's a little smoother. The whole feeling of the brain is like the white part of a hard-boiled egg. It's firm, yet you could easily slice through it with your scalpel. Lateral ventricles right here. If you put your probe into the space of one of the lateral ventricles and pull up, you should be able to pull out a little piece of the choroid plexus. That's that little capillary bed that functions to create the cerebral spinal fluid. On this side, and it's always a gamble because you never know exactly where your scalpel is going to hit, but on this side I got a pretty good septum pellucidum right there. I'm gently moving my probe under it. It's that membrane between the lateral ventricles. Septum pellucidum. Now in this area, you've got the diencephalon that you had on your quiz this morning. So this is the area called the thalamus. The area beneath it, but above the pituitary gland, is the hypothalamus. Moving back then, this is the mesencephalon. Are we sure? We don't know. So we go around the back and we say, oh, yeah, that's where my corpora quadrigemina was. I can see it right here, where I pull down the cerebellum. So I know, yeah, this area is the mesencephalon, kind of the joint in the wrist of the analogy we've been using in class. Then I know pons, medulla, spinal cord, and the pons does bulge forward slightly. The medulla bulges a little as it approaches the bottom of the pons. Spinal cord starts to look pretty tapered and flat. When you look inside the cerebellum, you'll see this white matter that's branching in a tree-like pattern. It's actually kind of pretty. Those are the arbor vitae, arbor, tree, vitae, vital branches off the tree. The folia, leaves, are those horizontal striations that we see on the outside of the cerebellum. So there is a relationship between the arbor vitae and the folia in terms of the words used there in regard to the cerebellar structures. Third ventricle, cerebral aqueduct, and fourth ventricle. Those are really difficult to see on this or to envision, to understand, because they lie on the midline. So we cut down the middle of something that lies on the midline. So we have taken it apart when we do this because it's a space, remember. So you really can't see it. The third ventricle is this space around the front of and between the two lobes of the diencephalon. And then they connect via the cerebral aqueduct to this area in front of the cerebellum. I tend not to ask for the third, fourth, and cerebral aqueduct off the sheep brain or the doggy toy models, the squeaky ones. They don't squeak, but the rubbery ones. I ask that off the ventricle model because that's really the easiest place to see it. But we're trying to work at an understanding of those, and perceptually it is difficult. Okay, but you can see the lateral ventricles nicely here on both sides. Let's see if we can pull out the choroid on this side. There it is under my probe. See it pink right there. Post-central gyrus and pre-central gyrus. Here is that central sulcus, pre and post. Post being more highly developed, you can see, than the pre-central gyrus. Sensory versus motor. I believe that is everything that you need on your Unit 3 list. Once we've got it sliced open, here is that pineal gland that I was showing you right above the corpora quadrigemina before. There it is. Where's the massa intermedia here? It would be a piece of a bridge of tissue between these two lobes that we cut through. It was right here, and we cut through it, so you don't see it. That's why on all of the models that you've looked at, they represent it as just kind of a brown oval right there. And in our analogy, it was that pencil that we held between the lobes. Okay? Alrighty. Who haven't not given anything to this quarter at all? Cat dissection, eyeball dissection, nothing.
Us?
You? Okay, then you can have that.
We already grabbed one.